Hi, this is Sandra Dinwiddie for NUR612 Health Assessment, and this is my patient. I'm going to go ahead and get started and complete his head-to-toe assessment. So prior to getting started, I asked him to empty his bladder, put on comfortable clothing, and I was able to take a full set of vitals, including his height and weight, to collect his BMI. I also took his Rosenberg vision test for near vision and Snellen test for distance vision. And now I'm going to go ahead and inspect his head. Okay. It appears free of lesions. The hair distribution is even. Okay. The face is symmetric, as I mentioned. So I'm going to palpate his head. It appears normal cephalic. The scalp moves freely. I'm going to touch his frontal and maxillary sinuses. Any pain or discomfort? Okay. Now, can you open and close your mouth? Testing his TMJ, our temporomandibular joint. There doesn't appear to be any clicking or pain. I'm now going to ask you to follow a few directions for me. Can you, while I look into your face, can you close your eyes tight? Can you shrug? I'm sorry. Smile. Open your eyes. Frown. Puff out your cheeks. Stick out your tongue. Okay. That's testing cranial nerve 5, the trigeminal nerve. I have a broken Q-tip, and I'm going to use it on different parts of your face, and I need for you to tell me if you feel sharp or soft. Close your eyes, please.
Soft. Soft. Sharp. Sharp. Soft. Soft.
Okay, so by touching his forehead, his cheeks, and his chin, I was able to assess that the trigeminal, facial, and hypoglossal cranial nerves 5, 7, and 12, respectively, are all intact. Okay, so now onto his eyes, looking at his eyebrows. They're growing out to the outer canvas. His eyelashes are growing up and outward. Lacrimal glands are clear. There's no excessive tearing or dryness. I'm going to open your eyes. Look up. Okay. The conjunctiva is pink and moist. Sclera is white. There is no indication of jaundice. I'm going to palpate your eyes. Any pain or tenderness as I do that? Okay. I'm going to get my pen light. Okay. So I'm going to have you look at me, please. Just turn your head and look at me. Okay. So can you look at an object across the room, please? Focus on that. I'm going to come in with my finger, checking to see that pupils constrict. Okay, perfect. So I've assessed that his pupils are equal in size. They react to light. So I've got perla, they're direct and concentric, and I have tested and they accommodate appropriately. So now I'm going to use this booklet to elicit the cover-on-cover test. So just look ahead. Okay, so you're doing the cover-on-cover test. I noted eye movement. There was no strabismus. Okay, now I'm going to test. I'm going to move this light about and just follow it with your eyes, please. Okay, I'm testing the cardinal field of gaze in six areas. There's no nystagmus. The eyes converge and with the pen light. So I was able to test then cranial nerves 3, 4, and 6, the oculomotor, trochlear, and the abducis. All right, so now moving on to his ears and inspecting his ears. They appear level with his eyes. They are not low set. I'm going to palpate his ears for any tenderness. Any tenderness?
No.
And tug on auricles. Any pain?
No.
So negative tug test. Now cover one ear, please. Repeat what I say.
ABC.
Yeah.
1, 2, 3.
Okay, so I just conducted the whisper test and had him repeat what I whispered into each ear. So that's positive. I've got my tuning fork here. Now I'm going to do the Weber test. I want you to tell me whether or not you hear the God damn it. Whether or not you hear the noise equally on both sides. You hear
Yes.
equally? Perfect. Okay, so now I'm going to do the Rhine test, and I'm looking for air conduction to be twice as long as bone conduction.
Okay.
All right.
Okay. Okay.
All right. So I counted during that time, and so the air conduction was twice as long as bone conduction when placing the tuning fork at his ear and on his sternomastoid. So now I have my otoscope and the cover for my otoscope. Bring it on. I look inside of both ears. Okay. So, and looking in both ears, there didn't appear both the ear canals appeared pink. There was no swelling or edema. There's no excess secremen in either of the canals. The tympanic membrane was pearly gray, intact. There didn't appear to be any bulging. I was able to see good cones of light. They're visible. So now onto the nose. It doesn't appear as though there's any trauma or lesions. Can you cover one side for me and breathe in? Okay. Cover the other side. Breathe in. Okay. Smell that?
Lemon.
Very good. Okay, so I'm now going to palpate. Any pain or tenderness on palpation? Okay. So now I'm going to use my otoscope again, and I'm going to look in his nose. All right. There doesn't appear to be any turbinate enlargement. Nasal mucosa is pink, no draining, no polyps, no foreign bodies. The septum appeared to have slightly deviated. So now I'm going to look and use my tongue depressor, looking at his mouth, his teeth, his gums, the uvula, as well as soft and hard palate. And then testing for cranial nerves with the gag reflex. So can you open your mouth? Say ah. Okay. Now lift your tongue to the roof of your mouth. Good. Perfect. I'm going to push the tongue to the side. Other side. Okay. Now I'm going to test your gag reflex. Okay. All right. His teeth appear intact. The nasal mucosa is pink and moist. On sticking out his tongue, there didn't appear to be any lesions. His tongue is well palpated. The posterior pharynx, hard and soft palate all appeared intact. The uvula raised midline when I had him say ah. The tonsils did not appear to be there. And the gag reflex showed that cranial nerves 9, 10, and 12, the glossopharyngeal, vagus, and hypoglossal are all intact. Now onto his neck. Now looking at his neck, there don't appear to be any pulsations, no evidence of jugular vein distension. And can you move your head against my hand again? Okay. I'm going to have you shrug. Okay, good. All right. So that is testing cranial nerve 11, the spinal accessory nerve. And so from that, I'm going to have you do a couple range of motion items. Okay, can you move your chin to your chest? Now look up. Look up. Okay. Can you move side to side? Okay. Can you put your ear to your shoulder on both sides? Okay. Now I'm going to palpate for thyroid. Okay, can you swallow? Okay. There doesn't appear to be any masses or tenderness. The trachea is midline. It's carotid. Are both 2+ and strong. Now for the lymph nodes, okay, so I've got preocular, posterior, ocular, occipital, tonsillar, submandible, anterior, superficial, cervical, posterior, deep cervical chain, and the supraclavicular nodes. Not able to palpate any of the lymph nodes. Now I'm going to use my stethoscope and listen for any bruits at the carotid. All right, so it doesn't appear as though there are any issues. No, I didn't hear any bruise or thrills at the carotid arteries or at the thyroid. So now I'm going to look at his nails. Jesus Christ. So looking at the nails, there doesn't appear to be any pitting, any ridges. I've got good cap refill on his fingers. Skin turgor is great. And let's see. Brachial and radial pulses are all +2, regular and rate. Okay, so now I'm going to have you take off your shirt, please, and evaluate and inspect his posterior chest. Okay, so can you sit up just a bit? Sit up forward. No, scoot up in your chair.